Hello, hello. Good morning, everybody. We are live on Wednesday like we usually are for the maybe you want to get a little bit more active. That's our theme for this month. Reminder, next month theme is going to be all about veterans. We're kind of taking the Memorial Day and stretching it out all across June, so we should have some really interesting and fun guests there. So without further ado, with me today is Dr. Leach. Hello, Dr. Leach. Thank you for
Good morning.
So every time I talk to Dr. Leach, I always have to remind myself to sit up, and he's going to talk a lot about that today, and I think it's going to be absolutely fantastic. So, Dr. Leach, before we dive too far into this, though, you do have to answer my very favorite and very famous question. You have to tell us something not a lot of people know about yourself.
Yeah, so I put that in my presentation. Um, I was not always a chiropractor from day one, right? I started my career as an engineer. Math was something I excelled at. So kind of a fun fact, one of my earlier memories is I skipped kindergarten math and got a first grade math book then. I skipped eighth grade math. I set the curve in a lot of my math classes, like statistics and in school. So naturally, that's what I gravitated to. And then, I had some pretty serious injuries in my back that traditional allopathic medicine wasn't able to address appropriately or solve for me. So as a last resort, I reached out to chiropractic, and man, I got 98% better from the treatment that I did there, and it really changed my life. And at that time, I decided that this was my calling, and I wanted to provide that type of service and help change other people's lives the way mine was. And part of the problem out there was that this is something that's just not mainstream, I guess you could say. It's not advertised, like traditional medicine and pharmaceuticals are on TV. So not a lot of people know about it until they don't really have anywhere else to turn, and they say, I might as well try it. And then we get a bunch of success with a lot of those people.
Nice. Well, I'm excited to hear what you got and to kind of dive into it. So if you're ready, I'll go ahead and put your computer screen up, and we can get into your presentation.
All right, sounds good. Okay, so we are going to talk today a little bit about ergonomics. One of the things that I've gotten feedback from a lot of my patients is they used to work here at the office, and all of a sudden they got sent home and they're working from home. And whether or not they had a nice setup here at their office, this is what is just becoming too commonplace at home. And, over time, that's going to cause a lot of problems, some of which are unreversible that we're going to get into today. Okay. So just a little bit more about me as I put in there. I began my career as an engineer. The good thing about chiropractic now is that as we progress here, more and more evidence is coming out and being published from a scientific standpoint about the benefits of chiropractic versus allopathic medicine. Rehab is a good complementary medicine with that. But chiropractic is starting to pull ahead in a lot of those things. A lot of the benefits of chiropractic are it's a drug-free treatment. We get a lot of people that come in that are, taking medication for their pain or reducing inflammation or Flexerol or gabapentin. I'm sure many of you listening are probably on some of those drugs, and we can't prescribe those things. So our treatment has to be based around what we see going on, and then determining a plan about how we make that area healthier or reverse some of the things that we're seeing. In my office, I'm a lot more available than, trying to get scheduled with a osteopath or even your primary care physician a lot. So a lot of times we can get people in the same day, if not the next day. And particularly if you're in some sort of emergency, like a car accident, we will make time to see you. Because part of the problem with people who get in personal injury or car accidents is they don't really have anywhere to go except for the emergency room or some of these emergency clinics. Those clinics are designed to check you for life-threatening injuries, which is great. And you want to know, you definitely don't want, a brain bleed following, hitting your airbag or something along those lines. But as far as checking out the spine, shoulder, the hip, knee, any other thing that may have issues, we can take a look at that right away. Chiropractic in general is much lower cost than just a few, specialist doctor visits. And again, we go to straight directly treating the source of your problem versus covering up with some medications. So, the cost benefit of trying conservative care with chiropractic beats everything else. In my office, we do more extensive examinations than most other primary care providers. So we rely a lot upon orthopedic tests to help guide us to come up with the proper diagnosis. And then in our office, we have x-ray, so we can do immediate imaging right here. And given your symptoms, maybe what we see on the x-ray, if you need like an MRI or a CT, I can get you referred out to that immediately versus having to go through the red tape of getting into this doctor, then being referred over to this doctor, and waiting all this extensive time to get that proper imaging that you need. And again, if we find something that is a little out of the scope of our practice or a little bit more serious, we can get you referred to the right specialist a lot quicker than, again, having to wait to get those appointments with a primary care or other provider. So in my office here in the Denver Tech Center, it's just myself. I have a phenomenal therapeutic massage therapist named Autumn, and we have a brand new front desk associate named Chloe that's doing great so far. Okay. So in our office, what sets us apart, maybe I guess a little bit, we give a thorough report of findings. My average time going over a person's ailments on the second visit is 30 to 40 minutes. And I think it's very important for people to understand what's causing those issues. Because to be honest, from my perspective, it helps get compliance out of patients in order to do the things that I'm telling them to do. So everything that I ask patients to do, there's a reason that's tied into the findings that we see. In our office too, and I know this was a problem for me when I was in other chiropractic offices, we don't have people waiting around. We have simple rehab exercises that you can do on your own and other things that are going to take up your time while you're waiting to see me, which again, is something that I strive myself on because I've been to chiropractic offices where I've waited 40 minutes just to see the doctor for a few minutes. That's certainly not the case here. That's something that I always said would never happen in my office. As I mentioned before, we actually try to look and find out exactly what the source of the problem is, and then discuss the treatment plan that we do to directly address that. And then also the sequelae that happens, the other issues that happen around that area, make sure that we treat that as well. And one of the big things that I think separates me from a lot of physicians is, listen, I got into this because this changed my life, and I really actually do care about the well-being of all my patients. And I'm sure many of you listening out there have gone to doctors where you just felt like you're a number getting pushed through, and you didn't really feel like that person cared about you. That's certainly not something that you're going to see here. Okay. So one thing that I was asked to put in here is a little bit of pitfalls of what's happened to our business. And obviously for most people, and the biggest issue was what happened after coronavirus. So my practice actually opened in November of 2018. I was brought in, kind of got taken under by somebody who had ran a very successful practice for 20 years. He kind of retired out of practicing, and he helps new docs get their practices established, teaches them some of the business aspects, patient care, some of those things to help get doctors set up. And then he goes ahead and sells that practice for you. So it's a win-win situation on both ends, and that's what I got into. So in 2018, the way that we started out was just on face-to-face and community event marketing. So we would go around to some of the local businesses here in the tech center area. We would provide, 15-minute massages or so, and we would talk to people about what their problems are and invite them in. Or I have another guy that goes out to, marathons or festivals or something along those lines, advertises for us and offers, a promotion to come into our office. And that's solely what we relied on prior to coronavirus. So then coronavirus hit and our office closed for a couple months, which, from a business standpoint, kind of basically shut off our income. And then after that, we lost, at least 30% of our patient base, whether that was due to, financial reasons for people or fear of going out and potentially contracting coronavirus. So that kind of hit us hard. And essentially what that meant is we lost the ability to perform, our main form of marketing. So after coronavirus hit, the owner and my mentor kind of stepped up and went outside of our contract and said, "Hey, do you want to buy the practice right now?" Because what he saw was the practice in decline, and the liability that was going to be placed on the business as far as making any money and trying to get that business back and going. And I'm not the type of victim personality, and I knew that this is a passion for me, and I just keep my head down and make sure I take care of patients really well. So I took up his offer and I bought that practice in June of 2020, right shortly after we reopened. And since then, we've grown probably 50-60% during that time. And fortunately, we've not had to operate on any credit. So we pay all of our bills through debit right now. After coronavirus hit, though, we had to change the way that we market ourselves to the community. So we had to shift more to an online presence. So we created a new website. We created ease of use for new patients to get scheduled in our office. New patients can simply go online and go through our online scheduling system to schedule their initial appointment. And then, of course, I worked with a brand new SEO team that helped, make that more robust as well. And so now event marketing is starting to reopen. So instead of relying on one form of marketing, now we have two that's starting to reopen. So our business is going to be better off for that. In a sense, coronavirus is one of the best things that happened to us because it forced us to open up more opportunities to create exposure to our office. And now that things are starting to return to normal, we're able to kind of add those back on top. Okay, let's move on. We got a little bit to talk about, and I want to get this done in a decent amount of time. So let's talk about proper desk posture. So the first thing I want you to remember is 90-90-90. So if we look at this picture over here on the right, essentially what do we see? We see the shoulders hanging straight down pretty much, or the elbows hanging straight down from the shoulders, and then our forearms extended at about 90 degrees straight out from that. 90 degrees is good or slightly below. Then we see our waist 90 degrees straight out from the seat and our knees bent at 90 degrees. Okay, so this is the proper setup. Now I know, workstations are different and you can't get it perfect, but you just need to keep this in mind and try to get it as close as possible. For example, if your feet or your legs are a little short, go ahead and put a footrest down under the feet to help for some support there. The lumbar support for the low back is a must-have, and we're going to talk about that here in a second. So again,
Dr. Leach, quick question
sure.
that just popped up in chat. This person's been getting a lot of advertisements from Facebook for one of those, like, I don't know, they're like straps that go over your shoulders to pull you back a little bit. Is that something that that kind of aligns with what you're talking about? Or
you know what, I get that question, and I'm so happy you asked that because that's actually a trap. Okay. So let's say you have poor posture and you're going to be doing an activity that causes you some pain and stress. You should wear that during that if you want to avoid some of the symptoms that you're going to have for that. But long term, it's not a solution. So what that does is that compensates or takes over for the muscles that are trying to pull you back in the first place. So when you start to add that external support in there, over time, those muscles that are trying to pull you back originally are not going to be activated anymore. They're not going to be used. They get weaker. So over time, from a long-term perspective, you actually become addicted or reliant upon those types of back braces.
Okay. Thank you.
No problem. That's a great question. And There's another one I guess I'm going to bring up real quick that I hear. Um, we'll get to that one in a second because I have some slides that are a little bit more relevant. Okay, so again, this is the proper setup. One of the things also that's missed a lot is this viewing distance. So as you can see, 19 to 24 inches. Now that's variable based on you. If you find yourself having to bend forward to read, your monitor is too far away and you need to pull it for you. So all of this setup goes away if you have to lean your head forward to see that computer. There's also another way that we're going to get into that's going to pull all of this away, and that is if you have to reach for the keyboard. We're going to go over this again, but I want to because I can't harp on this point enough. That keyboard needs to come to you. You do not go to that keyboard. Okay. So improper, right? This picture up here on the right of this lady on the laptop, this is something that is commonplace at home, or the picture in the center of people working at home. These are going to cause you issues over time. Not only pain and tension that you're seeing now, but we're going to go over what that can cause as far as permanent changes in your spine later. So I get a lot of people too. I wanted to throw this one in here on the top left. I get people, well, I sit on this ball. Okay. Well, the purpose of sitting on the ball, so to speak, is to allow your core muscles to be more engaged. So it's good for your core long term instead of taking, away that activation of the core while you're sitting in a chair all day. But just because you're sitting on a ball doesn't mean that your posture is correct. So, and it actually opens you up to have this type of posture, this leaning forward posture, because you don't have proper lumbar support in there. So, whatever trick that you have, or I have this awesome footrest, or I use this or that, that's great. Whatever you want to do is fine. Just make sure that we're getting to this neutral position the best that we can. Okay. Now laptops are horrible for regular use for working. Okay. The only pros for laptop is, a little bit of short-term working, and you could take it with you and do a little bit of work on the go. But the cons, it's just horrible for long-term posture. And why? So what we went over back there before, there's no way to have it both ways. There's no way to have proper monitor height, and there's no way to combine that with proper keyboard height. One or two of those have to be off. And what most people do is put it right in the middle. So we have improper monitor height and we have improper keyboard height as well. And a lot of people, if you were to videotape yourself, this picture up here on the top right, that's what a lot of people fall into from this. Now, there's no amount of treatment that I can do for you that's going to prevent you from having pain when you sit like this all day. Okay, lumbar support is a must. Okay, so we can see this picture on the right, that lumbar support. That lumbar support can go down in the small of the back all the way up to your middle of your back. That's going to do a couple things. First of all, it's going to help you sit back in your chair further, and that's also going to help you sit up straighter regardless of where you put that lumbar support from the small to the middle of your back. And it's also going to take pressure off the lumbar spine, which we're going to look at here in a second. Now, I wrote this in here, prevents excessive slouching. Yes, it does. Listen, everybody's going to slouch to some degree, okay? It's almost impossible not to. The idea is to set your posture up as correctly as you can, and you will slouch the least. So when we talk about great lumbar support, we look online and we're like, oh, this chair's, rated excellent for lumbar support and ergonomics, and it's a $1,200 chair. It seems a little unreasonable. Well, you don't necessarily need to buy a $1,200 chair. You can buy one of these little $20 lumbar supports here, and that's going to solve your problem just the same. Okay, so you don't need to go out and spend a ton of money to get yourself an ergonomic setup like that. All right, so I mentioned this before, and I mentioned that we were going to talk about this again, but do not reach for the keyboard. Okay, so if we look at the picture here of the lady on the right, what do we see? Those elbows are not hanging straight down at her side, and those forearms are not bent at 90 degrees. Okay, so what's that going to do? If we look at what that does to the scapula up here, that's going to widen out our scapula. And as we can see on this diagram, it's going to cause our neck extensors to be contracted the whole time. So one of the big muscles that we feel, and a lot of you guys feel this when you go get a massage. So when they go right over this angle of the scapula, when you go to a massage, you can feel it and you're like, oh, that's a spot. And it's just a pretty thin spot. And you wish that person would rub over and over and over again. That's this muscle in green here called our levator scapula. And as we can see, that muscle just attaches to the top of the spine and to the angle of the scapula here. So what are two things that would stress this muscle out? And again, this is one of the most common muscles that we see under chronic tension with people that come into my office. So forward head posture, right, would pull this forward and cause tension here. And then if we spread out the scapula, that's just causing tension from the other angle. So that's what we get when we reach for the keyboard. It rounds our shoulders forward, it pulls our head forward, it stresses these upper neck muscles. Most people come in and say they have neck and shoulder pain. They're actually misspoken. It's not shoulder pain, it's what we call cervical dorsal pain, or that area where this upper trapezius comes from. So that trapezius attaches to our neck and our skull, comes out towards our shoulder. They're misspoken to say the shoulder joint itself or the deltoid muscle that's around that, that's not their issue. Again, it's this extension of the neck called the cervical dorsal area. So again, looking at the diagram here, how do we stress that out? Forward head posture, reaching forward, causing rounded shoulders, and that causes us to have a more rounded back here, and that's what's going to cause this chronic tension that we have. So let's talk about a little bit about lumbar pressure. This is a common thing that we have. Unfortunately, there's too many people in this country that suffer from lumbar disc issues that are not necessarily even diagnosed yet. It doesn't have to be a blown out lumbar disc. It can be irritated, it can be slightly torn, and that's going to cause you problems. So basically, this was a study that's done that shows the relative amount of pressure that we put on our lumbar disc given certain positions. So we can see the guy standing up right here, right? That's our neutral position. So they baseline that at 100. And if we look over here to the guy sitting with pretty much proper posture at the workstation, we can see that they're putting even almost 1.5 times the pressure on their lumbar disc. If we look at the guy next to him, right, that's almost twice the amount of pressure on the lumbar disc. And again, this is what we're seeing a lot of people doing at home. Okay, now we're going to talk about standing desk briefly coming up, but standing desk, the posture has to be similar. You can't be reaching for the keyboard and leaning forward, or that's still going to cause problems in your lumbar spine there. These two guys up here, these are just these postures with weight, and of course that's going to put more pressure on the disc there. So here it is, the standing desk, right, versus the sitting desk. Well, if you look above the waist, pretty much everything's the same. Monitor height changes a little bit, but monitor distance, elbows straight down, or excuse me, yeah, elbows straight down from the shoulders, forearms straight out. We need this setup, not reaching for the keyboard, not reaching for the keyboard, not reaching for the keyboard. This is just one of the biggest problems that I see. So I'm going to repeat it multiple times. But essentially, yes, it's the same thing other than the waist and maybe something under your feet, but the setup is the same. Okay.
Wait, so should we reach for our keyboard?
Definitely never reach for the keyboard. Okay.
Got it.
So we're going to talk about now what happens when we do this repetitively over time. What we just looked at was how do we stress out the muscles, right? Or the joints. We're not even going to talk about joint capsule irritation. I don't have time to get into that today, but that's certainly another aspect of this. So let's talk about this. So they've done these studies to say how much pressure is put on your lower cervical spine given certain head positions. So your head weighs about 12 pounds. So in a neutral position, that spine feels like it's carrying 12 pounds. And for every inch of forward head posture, the base of your cervical spine feels like it carries an additional 10 pounds. So the 42-pound head, which there's an article here that you guys can look up, and I highly recommend that you read. Okay. So the 42-pound head is referencing a 3-inch forward neck, right, on top of your already 12-pound head. So that's one thing that, is harped on about how that puts pressure on the cervical spine. But what it also does is it changes everything else in your spine. The neck is the open-ended lever arm of the entire spine. So when we pull that forward, that's going to cause this counteracting balance in your mid-back. The number one cause for mid-back pain is forward head posture. The number one treatment for mid back pain is fixing forward head posture. It's not massaging your mid back. I get people in here. In our office, we don't chase symptoms. We try to find problems and fix those and then watch the symptoms go away. If you're going to somebody who chases your symptoms all the time, that's all you're ever going to get. You have to treat the source of the problem. So anyway, the mid-back tension is highly increased when the head comes forward. And usually when your head comes forward, what are you doing? You're reaching out, right? Which is going to open up those scapulae in the back and actually cause even more tension in another plane there, okay? But it also causes pelvic tilt. All right. So if you guys just Google the 42-pound head, you can find this article. This is going to explain some other things that I'm not even going over. And a lot of the referenced people in here are Nobel Prize neurologists. So I'm going to show you this is a pretty good article to read. It's just like 2.5 pages, and it's a pretty easy read. Okay, so let's go back. We're coming up to our last topic here, which is again, the long-term effects, not just what's happening on a day-to-day basis, but how this changes your spine over time and the complications that arise from that. So I'm actually cervical spondylosis. Let's just call this degeneration, okay, or breaking down of the spine. And I'm actually going to take the time here to read this little paragraph to you. So aging is the major risk factor that contributes to the onset of cervical spondylosis, let's call it degeneration. Several acute and chronic symptoms can occur that start with neck pain and may progress into cervical radiculopathy. Eventually, the degenerative cascade causes desiccation of the intervertebral disc or breaking down of the intervertebral disc, resulting in reduced disc height along the front margin of the cervical spine. This causes the front to start to bend forward and eventual loss of lordosis, which is the natural backwards curve away from our chin, okay, with compression on the nervous system and vascular structures. This altered posture of the cervical spine will progress into that neck bending forward or kyphosis and continue to pull that load balance off the back of the spine onto the front of the spine. So essentially the effects of degeneration will accelerate and continue if the load balance and the proper backwards curve of the neck is not restored. So this is a little bit more, you need a little bit of medical knowledge to go through this article, but it actually goes through and describes the processes that I'm kind of just going to scratch the surface here with you guys. So if we look at cervical spine loading, right? So here's our spine, right? These are our vertebral bodies. These gray things are our discs or our shock absorbers in there. And this back side of the spine, right behind the vertebral bodies and the disc, these are our joints. And this is where most of the load gets placed. This is strong, thick, solid bone. This is supposed to carry load. The vertebral bodies and the discs are softer, right, and spongy. So the front's designed to take a shock absorb, while the back is designed to carry load. So when we get that head starting to come forward like this, we're transferring weight off the back of the spine and we're putting chronic excessive load on these softer tissues and structures here. So over time, that's going to progress to all this stuff breaking down, which again, kind of going back to that article I referenced, that's how that describes this in detail and some pretty sophisticated medical terminology, actually. So let's take a look at some examples. These are actually patients in my office who've signed releases, allowed me to share their progress here. So we can see back here, this is somewhat recent. This is a younger person, born in 1996, and we see that head going forward. Now, before we get going, a lot of people have asked me, what causes this? Well, poor posture at the desk is definitely going to cause this, but what's the big one today? Texting, right? iPad, okay? All of those sorts of things. Reading, all right? Anything, we have so many things in technology today that puts our heads in these forward leaning positions, and our spine ends up adapting and changing over time. And it's not just the tension that you get, that comes with consequence. So this person right here, they said they can work on their ergonomics all they want, and they think they're sitting up straight. But at the end of the day, that cervical spine is not in the proper position, and they're causing these loads here to be improper, and that's going to lead to guarding. Right? The muscles your body doesn't want this to progress. So a lot of the muscles, the small intrinsic muscles and the big muscles, are going to protect this area and try to prevent it from going forward, which is going to contribute to chronic neck tightness and pain. So anyway, I know it's kind of hard to see, but we draw this line on the backside of the spine, and then this line populates, and this line represents where our neck should be. Okay, so we can see we got 33 millimeters, or almost an inch and a half of forward head posture. So we're putting excessive load again back down here on the bottom of the cervical spine. One of the other things we mentioned that we're not really going to talk about too much is the angle of this top vertebra here. Just so you know, we want that angle up over 30 degrees. That's the ideal angle. So anyway, we're looking at the spine. We can kind of see it comes up, and then it tends to take somewhat of a sharp turn relative to the rest of these moving forward. So we can see that this is starting to break down. This is transferring the weight off the back of the spine onto the front of the spine, putting excessive pressure on the vertebral bodies here in the disc. And then we're going to start to see changes in here, which I'm not going to go over on this one, even though they're subtle. We've got some other x-rays coming up that's going to make that look a lot better. So it's great to get the posture better, but what we're able to do for a lot of people in this office is help them restore that proper structure on the spine. This is the base. This is the foundation. If this is not being checked and addressed, you're always going to struggle with those problems. So let's look at another example real quick. We're not going to take a lot of time on this, but we can see again here, spine breaking down right here. And what do we see? This vertebral body looks different. When the vertebral bodies start to take excessive pressure and start to collapse down a little bit, the body responds, right? It has a defense mechanism. It wants to lay down more bone to fortify this area. You do not want the cervical spine collapsing. That'll just collapse right in on your spinal cord, and then you will cease to function because you will cease to communicate information from the brain to the rest of the body. So we see a little bit thinner disc here, and we see bone growth, right? Secondary bone growth to the collapse going down here. So while this bone growth will never reabsorb, okay, all we can do is try to get it to slow down or stop. And what's the best way to do that? Again, like that article I flew through, okay, we need to restore the proper lordosis or curve, backwards curve in the neck, to take that pressure off that vertebra to slow down or stop this progression of degeneration. Okay. So here's another one. This is just a different type of neck we see. This is called kind of military neck. But we see we commonly see the breakdowns happening in those same vertebrae down here in the spine. So we were able to help this person also get this neck changed to this. We're getting a little bit older here. This person was born in 69. So I want people to know that it's never too late. You're never too old. And this is a great example of that. This person was born in 1949. This is a little bit further progression of what we see. But again, kind of referencing back to that article, we see that kind of bending forward, sharply bending forward of what happens. And we can see a little bit more thorough degeneration here, thinner discs, secondary bone growth, trying to, fortify that area. And if you look closely, what does this ultimately want to do? These want to bridge together. Because in the absence of anything else, if your body's able to fuse these vertebrae together, it will mitigate some of that collapse. But that comes with other consequences we're not even going to get into today. So we were able to help this person, again, get back into a much more proper shape, taking pressure off this spine. At this person's age, I like to think that we added years to this person's life. Actually, I know we did. Okay, so those are some things that if anybody's interested in and wanted to come in, we can get into more detail with. But in conclusion, poor ergonomics is a serious, serious problem. It's just slow progressing. Okay, it's like smoking. It doesn't kill you today, but it'll kill you over time. All right. And it's important that some of these issues are addressed. As I went back to those slides, remember that degeneration is not reversible as far as the structure is concerned, but that doesn't mean that area can't be made healthier and we can't slow that down. Remember the 90-90-90. Elbow straight down from shoulders, forearms 90 degrees out or slightly below, hips 90 degrees out or slightly below. Okay. So the consequences of poor ergonomics don't just lead to chronic tension. Okay. It leads to dysfunction throughout the entire spine, as we went over. And headaches. This is something that we see improve a ton of when we fix the necks of of this and set up better ergonomics. So tension, a lot of people use the word migraine in my office, and migraine actually constitutes a very small percentage of people's headaches. Actually, tension headaches constitute 70% of the headaches. But migraine is just one of those common terms that people throw around when they have a severe headache. I can help you determine the difference of what type of headache you had. I mean, regardless of what type of headache you have, tension exacerbates all types of headaches. Okay, so if it's actually a true migraine, when you have all this excessive tension in the neck and at the base of the skull, your headache's going to be worse regardless of the type. Okay, so again, underlying spinal issues can be a direct result of poor posture. So it's not just, again, the tension, but when we start breaking down the spine, we're going to lead to further issues, which is just going to create a snowball effect in our chronic problems that we have. And again, the good news is this can be corrected. So if I got just one more minute here, I just want to kind of state a concept that helps people understand some of these things. So when we have chronic tension in the muscle, keep in mind that, the blood that flows through our body, right? It's a pressure system. So we have high arterial pressure and we have low venous pressure. Everything wants to move from high pressure to low pressure. So that's how our blood flows through our body. When our muscles are chronically tight and inflamed, they create a lot of pressure on that muscle, which is excessive. And that no longer becomes the pathway of least resistance for blood flow to get through to those muscles. All right. So that's why for a lot of people, it's hard to get that restored. And then when you go get a massage and break that up and get some of that inflammation out, and every time they push through that muscle, allows new blood to get through there, you're going to feel a lot better. But again, if you're getting massages, twice a month, once a week, and your problems aren't going anywhere, it's a great treatment for the chronically tight muscles, but unfortunately, it just does not address the underlying problems. And so you're always going to be spinning your wheels unless you get that addressed. So here's our contact information. If anybody wants any more information or interested in coming in, you can email me. Here's my email address. You can go to our website. As I mentioned at the beginning of the presentation, we do actually allow for new patients to schedule their initial appointment online. And here's our office phone number. So that's what I got for you guys. Thanks for letting me come on and share this. I know this is a big problem. Some of these things seem obvious when we go through them, but just necessarily aren't being performed. If you've been working at home since the pandemic started, and you always thought you were going to be going back to work and you haven't yet, it's time to set yourself up with a proper workstation at home. Please, please, please. It's really not that expensive. You don't need an expensive chair. A lot of people say, well, I don't have room. Listen, you can buy small desks off Amazon with, little keyboard tray extenders. You could put old books you're not reading underneath your monitor. I mean, there are ways to set this up. It does not have to be a significant cost for you. All right.
Fantastic. Thank you so much. I know for me, after our conversation, it was like a month ago, one of the first things I went out and bought, and it was like you said, it was like $10 on Amazon, but it takes my laptop and it tilts it at an angle. Like I can adjust the angle. So it's at a very sharp angle now. So my eyes are looking much better at the monitor and I'm not reaching as much for my keyboard, exactly like you talked about. So
yeah, that brings me up another point. I had this pulled up. I was thinking about I wanted to put this in here initially. So I can't get my windows. All right. So one of the things that we have a issue with is people looking down at papers next to their desk, right? So it's one thing to have your monitor up, but if you're having to read to type something, that's going to cause an issue too. So just get something like this. It's not very expensive, okay? And put your papers on this and read off of here. You can even get one of these, right, to tilt it up. And maybe you're looking down at it a little bit, like this might be. Just imagine those are papers there. But this is a great way to set up a laptop, by the way. He's got an external keyboard. He's got a mouse. Okay. He's not sitting the best. I get it because he's trying to look suave looking over here. But he's got his monitor height up from a laptop. And a lot of you who have laptops, you don't have to go out and buy a computer. You can buy just a monitor. You can set it up something like this. You can buy what's called a docking station. A docking station is something you plug all the peripherals into, a mouse, a keyboard, monitors, and then all you have to do is one cord plug in your laptop and it syncs with everything. And then you can take that out and take your laptop on the go.
Fantastic. Well, Dr. Leach, thank you so much. I know that there was some amazing info, and I appreciate your time, sir.
All right. Thank you. Yes, I have to go. I didn't realize what time it was.
No problem.
Everybody have a great day.
Too. Thank you, sir.